Fox Oldies 98.9. Love that Motown. Four Tops and Bernadette. It is 8 minutes past 8. It's Tuesday morning. It is actually Fat Tuesday. It's Mardi Gras. Tomorrow is Ash Wednesday. And I'm so excited this morning. I have been promoting the fact that Dr. Moss is going to be here at 8 o'clock in the studio. So I would like to give him his proper adieu as far as an introduction goes. He has a list of credits that is a mile long, and that's the only way that I could put this. He is diplomat of the American Board of Oral, and I hope I say this correctly, maxillofacial?
Correct. Very good.
Really?
Mm-hmm.
Gee, wonders never cease, do they? Surgery, the National Dental Board of Anesthesiology, fellow of the Dental Society of Anesthesiology, the American Association of Oral and Maxillofacial Surgeons of the New Jersey Society of Oral. And ladies and gentlemen, here's Dr. Moss.
Thank you, man. Appreciate the nice introduction.
I can't pronounce all this. Oh, my goodness.
I'm
so sorry.
Well.
Please
we usually
accept my
shorten
apologies.
it just to oral surgery and drop that difficult maxillofacial word.
It's great
My mom
to have
has always
you here.
struggled with that as well.
I was down to your office several months ago, down in Rutherford, New Jersey on Route 17, looking out the window at the Meadowlands right there, And, of course, it was during football season, and I love your office to start with. It's absolutely awesome. You have a wonderful staff there.
Appreciate
They
that.
are so helpful and so friendly with everything. But what I was amazed at, Doctor, more than anything, was how you do this procedure, the all-on-4. Someone like myself who's had problems all my life with my teeth and gums, I was told, I went through the screening, and I was told that I am a good candidate for this all-on-4. Okay, and if you would just explain this, how is this different? How does this differ from normal implants? This is what I don't get.
That's a good question, and that's a very common question because traditionally, when people have lost all of their teeth, or more commonly what we see is people like yourself perhaps on the verge of losing the rest of their teeth. And what do? 90% of Americans still address that situation with old-fashioned dentures, which are 200 and something years old. It's archaic technology at this point. So in the early 80s, implants were introduced to North America, and as a profession, as a society here, we extrapolated a lot from how teeth are retained in our mouths. They're straight up and down. We have many roots to support these teeth, or bridges as teeth get lost. And so we thought we needed 8 or 10 implants to support a full set of teeth because we didn't know any better.
Right, sure.
Over time, it took a person to challenge conventional wisdom, that person being Dr. Malo in 1993, that said, who says we need 8 or 10 implants? Who says they need to be straight up and down? Just because God or Mother Nature, and we could have that debate a different day, gave us all these roots and all these teeth, but implants behave differently. They physically bond to the bone so securely that you cannot remove that implant once it's, we say, integrated, or it's bonded with the bone. And it turns out Dr. Malo was right. We can place implants on angles, and we don't need more than 4 if they're strategically placed, meaning they're spread out in a way that allows us to support teeth in the front and back and both sides. But that is something that took somebody to challenge conventional wisdom, as I said, and then prove it scientifically, which has been done now for about 20 years. So the answer to your question is it's very different. It's the same implant, so to speak. It's just the way that they're inserted. They're inserted on angles to take advantage of the bone that still exists in your mouth. After we lose teeth, we tend to lose bone that used to hold the roots, so it becomes a difficult problem. Many patients, you're pointing at yourself.
That's what I've been told all my life.
Right,
that, I've lost a lot of bone. And, it's kind of iffy for me to do implants, all right?
Because they're looking to put them straight up and down, and often in the way, in the upper jaw, your maxillary sinuses, air-filled cavities behind your upper back teeth, or in the lower jaw, the nerve that supplies sensation to your lip and chin. Everybody who's been to the dentist and had a lower tooth worked on, the feeling for for 2.5, 3 hours, you can't feel your lip and chin. You're drooling all over yourself till that sensation comes back. Well, that nerve can't be violated. So what we do is we place the implants on an angle to avoid the sinus, to avoid the nerve. And if done strategically, it works beautifully, 98% success in the very long term, which is really far more superior to than what we've done in the past, which was add bone on top of those ridges beneath the sinuses or into the sinuses, something called a sinus lift.
And there's a long healing process for that too, right?
There is, because that bone has to heal. There's an additional expense. There's more surgery, so it involves more pain, more recovery, and it becomes almost like you feel as you're an annuity to the dental profession, going through all of these different procedures, and then maybe a year and a half later, you would finally get your teeth. Well, now we deliver teeth the same day we put the implants in, almost always. We do have some times where the bone is just too soft to support teeth the same day. It takes about 3 months to get that bond with the implant surface. So we're relying on basically a press fit or a tight screwed-in fit while we're waiting for that 3-month period. And if they don't go in as tight as we hope because the bone is so soft, bone can be kind of thought about as wood. You can have bone like oak, or you can have bone like balsa wood. Well, if it's balsa wood, no matter what you do, you're not going to screw that implant in very tightly. In those cases, you have to wait the 3 months, and then we add the teeth. But that's only about maybe 1 out of 100, 1%.
What do you do for teeth in the meantime, though?
Yeah, in that case, you'd have to wear something removable over the implants while they heal. Traditional
I see
denture,
what you're saying.
So
Okay.
you're never without teeth, but you don't have the benefit. You don't enjoy the security of teeth that are screwed onto the implants, and that's what we like to accomplish on day one. You walk in maybe with a few natural teeth left. We take them out, clean out any chronic infection you might have in the bone, place the implants, and then have something to eat or drink. After recovery, you go to the prosthodontist down the hall, and everything is in the same area in the facility, and they insert your teeth. So in 3/4 of a day, you could walk in like yourself. As you said, you have suffered your whole life, and those failing teeth can be removed, replaced, and you walk out and nobody's any wiser. You have a full set of teeth that look great, feel great, and your confidence is instantly given back to you.
How about a pain factor? Is there a pain factor involved here?
Yeah, that's another good question, Van. You'd be surprised. The majority of our patients, although we always write for a prescription pain pill because we want them to be comfortable, usually take it for 1 or 2 days and then switch to Advil and Tylenol.
That's terrific.
It's more uncomfortable actually to have implants placed and not have the teeth fixed. Once the teeth are fixed to that and nothing's moving, there's very, very little in discomfort. You might have a little bit of swelling for a day or two, but discomfort is typically very minimal.
We'll come back and talk some more. My special guest this morning is Dr. Moss from Malo Dental Implants in Rutherford, New Jersey, and just an outstanding doctor. And it's so great to have you here. We will come back and talk some more. It is 8:16 here at Fox Oldies, and time to check traffic. Traffic is brought to you by Garmin.
Of course, needles are smaller, so you don't feel them. Drills are faster, so they don't cut with discomfort any longer. But more importantly, when you come to the facility and you're going to have your implants placed, we've got some options as well. You mentioned my anesthesia credits, and all of my partners are in a similar boat. We have the ability to sedate you, make you feel very comfortable with intravenous medications. Or if you'd prefer to be completely asleep, we can go down the hall. This facility is really quite unique. I've got an ambulatory surgery center adjacent to me, which is part of the Malo Health and Wellness Complex. And an anesthesiologist can put you completely asleep, and we can do your procedures there. And sometimes that's necessary because of patients' medical conditions.
Sure.
Realize that we're talking about people here between the ages of 50 and 90. And as we age and we get into our 6th, 7th decades of life, we have some comorbidities, diabetes, hypertension. Many people have had stents placed. None of those things are a problem in receiving dental implants, but we are concerned about your safety during an anesthetic. So if we feel that's best for you, we'll go down the hall and we'll have the anesthesiologist put you to sleep. But the majority of patients, we're sedating in the office, giving them anesthesia as well, local anesthesia. And within 2 hours, we're typically finished. They have no recollection of the procedure. They're still comfortable because they've got the local anesthetic on board.
That's wonderful.
And they got their teeth usually by 2 in the afternoon.
That is just incredible. It really is. We'll come back and talk some more. We're going to take a break for news, and we will return. My special guest, Dr. Moss, this morning from Malo Dental. And I have I have a great question to ask you when we come back, Doctor. 8:31, Mr. Heistad's got a Fox News update coming up.
It's simple.
Fox Oldies 98.9, Paul Revere and the Raiders, and just a great song, Kicks. It is 20 minutes before 9. We have Dr. Moss with us in the studio from Malo Dental, and we have a phone caller for you, Doctor. Hello, caller.
I wanted to find out, what kind of insurance do you accept?
Well, that's a good question. We're asked that often. We accept most insurance plans, and we're certainly happy to work with them. Unfortunately, many of the plans out there are limited as far as how much they'll cover. Typically, it's $1,500, $2,000, or $2,500 max. But we do have some finance options available that we can talk to you about when you come in. They're basically interest-free loans through third parties that help to make this procedure more affordable for people like yourself.
Okay, that sounds good.
All right. Very good, sir. Thanks for calling. You have a great day.
You too, man.
All right. Bye-bye now.
Goodbye.
Okay, the next seminar is coming up, as we mentioned earlier, a week from tomorrow.
That's right.
Wednesday, March 12th. It's at 6 p.m. at your office, Malo Dental, 201 Route 17 North in Rutherford. Someone, if they want to come, they should probably call and make a reservation.
Yes,
right?
You can go online, malodentalimplants.com, and register. You can call our toll-free number, 855-MALO-800. That's 855-MALO-800, and speak to one of the young ladies, and they'll get you registered.
Mm-hmm. Or, like you said, you can go to your website, malodentalimplants.com.
Mm-hmm.
Okay, so you can either call or go to the website.
Right, and you'll submit a contact form, and they'll call you.
Now, what you do actually came from Europe to start with, right?
Correct.
All right, and you brought it here to the United States.
Well, Malo is named after Dr. Malo. Dr. Malo
sure.
was the pioneer of this all-on-4 procedure. As I mentioned, he first performed it in 1993. So the commercial we played during the break is actually not as accurate as it should be. It's not a new procedure. It's relatively new to this country. But
to this country,
correct.
Yes. You've been doing this for a long
just
time.
so the listeners understand, there's 15 years worth of research behind it, tens of thousands of patients with success rates that we haven't typically enjoyed before in implant dentistry. So it is really a revolution.
That is amazing. I am really looking forward to coming down and seeing you again. Okay, and if there are any dentists listening this morning, and I know we do have dentists that do listen to this radio station, Dr. Moss is looking for you for this area. Okay, so if you want to expound on that?
Sure, absolutely. We work with dentists all over the country because it's not always possible to get in your car or get on an airplane if you need an adjustment or should something break or become loose. Doesn't happen very often, but still we need to see you. Can't do it remotely, as we can do many things through the computer. So it makes sense, and we do have specialists at the facility. Myself as an oral surgeon, I've got prosthodontic colleagues who can help the dentists in these communities to understand what we do, help train them, and so they're able to participate in the patient's care. They're able to take care of the patients post-operatively. They can deliver the final bridge up here in their own office. We'll support them with anything that they need. We have lab that we'll make sure that the products are right, because there is a protocol. It's not just about the surgery. It's also the bridge that goes on it. That's how we ensure success. So everybody wins. The dentist in the local community, their patients are getting a procedure they might not have otherwise been offered. And, of course, we get to share in the patient's experience as well.
And again, if another dentist wants to call you, it would be the same number,
Absolutely.
I assume, right?
And just leave a message, and if we're busy, and we'll call you right back as soon as we can.
855-MALO-800. That's 855-MALO 800. Do you have anything else that you would like to add?
Sure. I mean, we could follow up with what we were just talking about. If there are any dentists in the community that would like to come and be a part of a 2-day course, there's one coming up May 2nd and May 3rd.
Nice.
It's just about an hour's drive from here. We'll introduce you to the facility and to Nobel Biocare, one of the largest implant manufacturers in the world. I would just also like to say that I'm often asked, am I a candidate for this, doctor? I've been told that I'm not a candidate for dental implants. And the answer almost always is yes, you are a candidate because we don't need to bone graft. We take advantage of the bone that exists in your upper or your lower jaw. And lastly, we also do what's called zygoma implants. If you have absolutely no bone in your upper jaw at all, we utilize the bone in your cheekbone to support the implants. And that's something that not many people in this country are capable of doing. So it is a special place. We do special things. We do support the local dental communities, help to treat their patients when necessary.
I am one of those where in the past, I think I mentioned this earlier, I was told that, it's kind of iffy with me as far as my being a candidate for implants.
Right.
Okay. And then when I came down to your office, went through the entire screening process, and 2 doctors came in to see me.
That's common.
And they said, you are definitely a good candidate.
Right. Those 2 doctors.
They looked at everything, okay? The x-rays,
absolutely.
Everything.
Those 2 doctors would have been one's the surgeon, one's the restorative dentist. Sometimes there's 3 doctors. Your own doctor comes with you. So, and then we all the other advantage is that not only are we together in the same facility, the laboratory is there. So what commonly breaks down in the real world, where you go from your dentist's office to see the periodontist to the surgeon in their office and back to your dentist, is communication. Well, we're all in the same place, so communication almost never breaks down. And that's the secret to success. Everybody on the same page before any scalpels are picked up.
Speaking about the communication involved, I really have to say, and I mean this sincerely, that both doctors that came in and talked to me explained everything thoroughly. And I like that.
Of course.
I like to know what's going to be done to me, you know what I'm saying?
Absolutely.
So, I thought that was terrific. And they were both extremely friendly, very, very nice.
Well, we take pride in that, and I appreciate those nice comments.
You have a great staff, Doctor. You really do. And I thank you so much for coming on the show. Again, friends, we remind you that the next seminar is at the Malo Dental Office, which, again, is 201 Route 17 North in Rutherford, New Jersey. It's about an hour from the station right here. So it's really not that far. Isn't it worth it, folks, to drive maybe an hour to see if you two can walk away feeling real good about yourself because you got a great smile? Man, that's what it's all about to me, brother, as far as I'm concerned.
Absolutely.
Okay, that number again, if you'd like to go to the seminar, and listen, it costs you nothing to find out. It's absolutely free. Is 855-MALO 800, 855-MALO 800. Doctor, thank you so much for coming in.
And much appreciated. Thank you.
And I look forward to seeing you again.
My pleasure. Can't wait.
All right. You have a wonderful day and drive safe.
You as well.
10 minutes before 9 here at Fox Oldies 98.9.